welcome everyone to today's webinar. I am Sachin Vora. I lead channel go-to-market and marketing at KenSci. For those of you who are not familiar with KenSci, KenSci is a AI healthcare startup based out of Seattle, Washington. We are an AI platform for healthcare, and we enable health organizations to get their AI and ML solutions deployed, developed, and scaled in their organizations. And for knowing more about what we do, please visit us at KenSci.com. Today, I will be moderating the discussion on how health systems can prepare for advanced analytics, technologies like artificial intelligence and machine learning, to name a few. For the discussion today, I am being joined by Tom Laurie from Microsoft and Dr. Chris Dale from Swedish. Tom is no stranger to this conversations. He's the National Director at Microsoft for AI in Healthcare and Life Sciences. He's also a well-known author, a keynote speaker, and thought leader in the space. Do check out his new book. He has AI in Health, A Leader's Guide to Winning in the New Age of Intelligent Health Systems. There's some really good actionable insights on operationalizing AI in your organizations. Dr. Chris Dale is also well known in the industry. He is as a chief medical officer at Swedish. He's also active on the board of Foundation for Healthcare Quality. We are also fortunate to have Dr. Chris Dale as an advisor at KenSci, helping us think through how we can continue to add value using AI for the healthcare industry. So welcome, Tom, welcome, Chris. It's a pleasure to have you today talking about the conversation we have on hand. And thank you for taking time out of your really busy schedules for this webinar.
Great to be here, Zagan.
Yep. Yeah, thanks for having us.
Welcome, guys. Let's get started, right? So for the discussion today, we want to cover a few things. First, we'll talk about where health systems can apply AI ML technologies to improve health outcomes in their organizations. We also will talk about what best-in-class health organizations and health systems and providers in specific do to maximize their value from using AI, and most importantly, how are they managing the time to value challenge, which is a predominant thing to kind of say AI can be a long cycle investment, but organizations who are doing it right are investing in a few things to get that time to value coming faster, right? And lastly, and very importantly, we'll also discuss the factors which can help organizations facilitate adoption of AI in their workflows. So without further ado, let us get started with the first topic, which is opportunity for AI ML in health systems. So Chris, I'll start on this one with you. The world has changed, right? So we are in a very different world than we were in 2019. There was a pre-COVID world, and now there is this new today that we live in. And it would be great for you to help us set the stage for what that means. What has changed? How has the pandemic shifted the priorities for health systems? So get us started, please, Chris.
Well, yeah, no, and Sachin, it's thanks very much for the opportunity to be here. It's great to spend a little bit of time with y'all. I was thinking about this in terms of it's been quite a journey for us. I'm at Swedish up here in Seattle, and we had one of the first cases of COVID. I don't know, whatever, 14 months ago now, 15 months ago, and the last year has been I've been thinking about it as a little bit of a pressure cooker. Like there were already ecological trends occurring in our industry in terms of change, and the technology part of the change that we're talking about today is like a good case in point. And I think for us, like that COVID really highlighted two things. One, that we need to, as organizations, figure out how to deal with and kind of manage that change, how to translate knowledge into practice. And there's a lot of good opportunities for systems of intelligence to help us with that across our industry. But one of the successes that we kind of had, or we feel like we had, was going from kind of guidelines or known best practices to reliable implementation. And I would say during the times of COVID, we really did that in kind of an old school way with like collaboratives and people getting together and that kind of thing. But it's really hard to scale outside of a global pandemic. So I think that there's a big opportunity for more advanced systems there. And the second, which actually gets to the last point there on that you had on the introduction slide about you know, how do you move forward a little bit, or what is the kind of the organizational context of AI is. It was a very unifying time for us because of kind of this big threat that was facing both our patients and our organizations, and it allowed us to come together and to manage the change and to think organizationally about, okay, if we're going to go from A to B with respect to delivering good COVID care, like what does that mean in terms of, you know, protecting our workforce, and what does that mean in terms of the therapies that we're delivering to patients? And I think that those lessons are always applicable to organizational change, but the times of COVID really helped us refine and focus. And now we're kind of coming out of it, and we're getting back to the way things have been historically, with a bunch of competing priorities where, you know, AI, ML, or just optimization in the informatics space is something that's one thing on a long list of things. You know, and people might be thinking more about equity at this point in time, or might be thinking more about vaccination, or they might be thinking about kind of getting back to the basics in terms of business fundamentals. And so I think that really thinking about how the organization can draw on lessons of how it goes about processing priorities and then effectively executing those, like that's something that's a very helpful thing in terms of the adoption of AI ML to clarify with organizational leaders in terms of how it fits into other priorities so that change can be successful. So yeah, it's certainly been a heck of a journey this past year.
No doubt. I think we all have had shifts in our thinking, shifts in our priorities, and I mean the whole idea of what was important versus what is necessary has definitely shifted during the time. Now, Tom, coming to you a little bit, you talk to a wide set of organizations, right, that are in different stages of leveraging data analytics and AI ML. And that's your area of specialization in terms of what you talk and what you do in your day-to-day professional life as well. So what are the key trends you are seeing as it relates to AI ML, and just where does it sit now on the priorities for healthcare? So lead us through that conversation and discussion, please.
Well, probably building on some of the things Chris said, the world's a very different place today than it was 1 year ago. And, you know, we've learned a lot. The first thing I always like to point out is we learned that when faced with a major challenge, healthcare and health leaders are very capable of agile transformation. So you look at what happened in the last year, some of the things Chris talked about, you know, the clinicians, physicians, nurses, others went through heroic efforts to basically reformat a lot of things in how care is delivered, how healthcare services are practiced. So with that, we see the shift from a lot of traditional ways of doing things and a very heavy emphasis on telemedicine, on virtual visits, on remote monitoring, on digital collaboration. When you look at that, it's all driven by the humans, but playing a key supporting role was the digital technologies, much of which under the hood is really that intelligence that we're talking about today. So the other thing we learned is that when properly curated, AI can clearly drive rapid time to value. So for example, and I'm sure Chris has examples of Swedish, and I know KenSci has done a lot of great work in the last year, but I just look at when COVID started really coming forward in the United States. Microsoft already had a health grade health bot, and we quickly spun that into a COVID bot. It was adopted by groups like CDC and hospitals around the world. It handled literally tens of millions of inquiries of nervous consumers. They had the ability to go in, walk through a triage system on their symptoms, and then what to do on next best steps. So you can only imagine tens of millions of consumers being served. What if they were calling into a phone bank and that was being handled by humans? How would that have worked? So we see a lot of things, and I think going forward, you know, people have now woken up to the value prop. And then finally, Microsoft just partnered with The Economist. We literally just released this study in the last week where we took a look at what are some of the global impacts of what we learned and how we transfer that knowledge going forward. And one of the things that the study clearly shows is that those organizations that were already in the cloud or moving in the cloud, that were already building those fundamentals on intelligence, were much better able to navigate not only their own business goals and not only surviving but doing well, but that was also a key factor in how they were able to help their staff, in the case of hospitals, doctors, nurses, any knowledge worker, really transition to that new way of working. Without that, companies that were behind faced a very different future compared to those that were already involved.
No, that's a great point. I think, look, you mentioned how you repurposed the bot into COVID-specific things. At KenSci, we did similar stuff, right? I mean, we came out with our COVID command center for tracking beds and ventilators and also tracking the patient statuses. So a lot of things have changed, but I think at KenSci, we like to look at the broader spectrum of the use cases that are where we are able to see the impact of AI. And Chris, coming to you, some of the things that we have seen in pre-COVID times as well, but continues to be a factor even when we are operating through these times, the new world today, is that the use cases are still similar. I think they have changed in some aspects, but the areas that we are continuing to explore. So, for instance, operational areas like length of stay and risk of readmission, basically patient flow related stuff, that is important. It has been modified to kind of now cater to the COVID patient movement, for instance. The clinical pop health use cases and scenarios, essentially think of diabetes management or COPD, and then also a lot of care management and quality of care use cases. All those things are still continuing to be in the conversation with a different angle, a different viewpoint. So from your perspective, what are those specific areas that you believe are ripe for leveraging AI, ML, and just advanced analytics techniques that can lead to efficiencies and generate what I call value in the health systems, operations, or clinical outcomes and care outcomes?
Yeah, I think it's a good question because, and I don't know, like I'm kind of like natively a skeptic about certain things. Like I kind of think that some of the themes of human existence that were present in the times of Shakespeare are still present now. And similarly, like the problems that our industry was faced with, 5 years ago, like COVID was this, asteroid that hit the planet, but they're still present now, right? So I spend a lot of time working on the acute side right now, and in the same cost pressures and the same need to figure out, okay, how are we going to get a margin in this like very, very, capital intense, labor intense business? Like these things still exist. And so COVID was actually good in terms of I think KenSci is to be commended for putting together that operational command system for the times of COVID. But that's exactly the type of thinking that we're on in terms of a journey as an industry, right? Like if you rewind the clock like 20 years, the hospitals are just basically, I heard them called once a job shop, and I like that mental model. Is like it's a place where very skilled craftsmen and go to apply their trade, and it's really through the heroic efforts of individual doctors or nurses or other caregivers that people have unreliably good outcomes. And this future that we're navigating towards is not that at all. It's a place where people go to work with teams, or patients go to work to get care from teams of people who reliably deliver excellent outcomes. And so that kind of that transformation journey that we're all on right now, like that's what those same trends that were existent during COVID times, they're going to be existent in the future. And so some of the things to think about for for us here at Swedish, like we're like any other acute care delivery system, we're very focused on throughput and lengths of stay, and then the staffing component that goes with it. So, the past is prelude, right? Like, so the things that were of interest to us prior to the pandemic in terms of, how much staff do we need on which days of the week and by which shift and at which periods of time during those shifts in order to care for patients as they flow from, from the OR to like wards or in and out of the ICU into the ED. Like that's a very interesting problem to solve, and it's one that's readily amenable to ML sort of solutions. Similarly, like predicting lengths of stay and saying, okay, well, here are the people who are predicted to go home soon. Maybe they're not as in need of interventions in terms of social work or other things to move along their care journey, versus another set of people who are predicted to have excessive lengths of stay. Like the organization has an interest in trying to move all those things along. And so I think those things were certainly, present in 2018 and 2019. But I think that through the times of COVID and just forecasting forward, the same cost pressures exist, the same need to operate efficiently. I think consumers, quite correctly, increasingly are less tolerant of errors or deviations from best practices, and we in the industry should be that way too. So the safety uses of AI, ML also, or artificial intelligence also, are as true now as they were 5 years ago. So I just forecast that it's kind of like people talking about office space, maybe COVID transformed the way we work, or maybe we're going to go back. And so where's that set point going to be? I think that the future will hold continued trends that were existing prior to the pandemic. But it'll be interesting to see.
Yes.
Can I pile onto that, Chris?
Yeah.
I mean, you said a lot of things that fired up brain cells. So, to your question earlier, I mean, really, the question is almost, what is it that AI can't be applied to? So, Chris, as you're talking, I'm thinking about all the COVID examples, but then just what you said, imagine our ability to get better at risk rating each and every patient. We're not talking about broad, protocols, but literally being able to assess and get it down to helping to manage their health across all care settings. So the acute care setting that you mentioned, the ability to risk rate for things like of the patients that we just put in the hospital as inpatients, risk rating to say which ones are at higher risk for an unexpected adverse event and getting out ahead of it. If I can do that, we've already talked about risk rating to be able to say which of these patients might be at higher risk for falls, for nosocomial infections, and all of these things which represent a quality improvement if we can get ahead of it. But then the way the economics in America work, if I can keep you out of ICU, if I can keep you from having a hospital-acquired infection, that's going to please the CFO as well, because typically those are fixed pay by DRG cases. And then beyond that, back to COVID, the one thing that our new study pointed out is it shined a light on what we already knew, which is many times we've got talented clinicians working with kind of old, outdated processes, protocols. And I mean, just look at the problem and challenge of burnout among clinicians. COVID didn't exactly make that better. Interesting to me, Accenture did a study that said up to 30% of all activities that a physician and nurse do could be somehow augmented or automated through the use of AI. So imagine if that's true, giving doctors and nurses 30% of their time back to do research, to spend more time actually looking in the eyes of patients, or perhaps this radical idea of actually getting home for dinner a little more often.
That's I think what you are pointing to, Tom, is pretty much jives with how we have seen it, right? Which is that there is efficiencies to be unlocked, and really it's a scale of have organizations kind of focused on a problem. As soon as they focus on the problem, then the needle starts to move, and then there's a shift between taking data and then using it to really start moving the needle on how efficiently that data will transform that area of focus, right? So that's the spectrum on which AI then finds itself applicable to really fast forward to where efficiencies are now really being squeezed out of that system, which is great for patients, great for the system, and so on. So, Tom, on this section, a foundational question I want to ask, and this might be what our audiences are thinking about as well, right? Because AI, as we said, there's a wide spectrum of problems it can be applied to, and just depends on where the focus is for a specific health system. But very importantly, if you take a step back, how should we think about AI in healthcare? Is AI an organizational capacity and capability, or is it about a specific point of application and saying, let me solve this problem and AI can help? So quickly lead us through that as to where does organizational DNA and point application, where should the organization think in those terminologies?
It's an outstanding question. So I have the privilege of being a strategic advisor to a lot of very large healthcare organizations, providers, payers, and some life science. And many times AI starts bubbling up with a group of individuals who typically are rallying around a specific or explicit use case. And that's the place to start. But those organizations who go on to really drive innovation or transformations measurable at scale really take that organizational approach. An organizational approach goes well beyond the talents of those chief medical informaticists, data science people, the chief technology officer. It really is an organizational initiative that starts with what I call the leadership imperative. Anyone in the C-suite, the clinical leaders, understanding, they don't have to understand how an algorithm works. They have to understand the components and what they're capable of, because they're the ones that are smartest at how to solve for the tough problems on things like clinical decision support. So it's that leadership imperative, which then cascades down to a certain set of activities, including the majority of time that it takes, even when you spin an AI project up and it's successful, is all about that data. And if you don't pay attention to that, if you have systems that take so long, that's where, to your earlier point, that's the number one factor on time to value. It's also the number one predictor in whether a project is going to fail. So those are just some of the things, but we could spend the whole time talking about all of those factors that really lead to what I think is most important, which is setting up systems to be able to do transformation at scale across the enterprise.
So that's a great segue to our upcoming topic as well. So before we go into that topic, let me get to our audience, get a poll question where they believe is their organization in the use of AI ML, and it could be on any of the dimensions, operational, clinical, care outcomes. So is it early stages, or just we are in the experimental use phase? Are organizations already using AI ML in certain workflows and trying to predict outcomes in certain aspects of their businesses and the health system? Or some organizations might already have a data science team that is actively building that capacity and the capability of AI ML to the point that you mentioned, Tom. Where do we fall? So we'll see how the audience here gives us that insight into where they are. But Tom, isn't this really a wide spectrum? There is no one place. It's not like we are not playing the kiddie soccer where everybody's following the ball. It's all over, and everybody has their own version of how AI ML is being.
Yeah, it's a great question. As the data is coming in, I think it's very representative of what I see, where there are times where I get to do a lot of talks and presentations, and I get a lot of interviews. And when we talk about these use cases, I think there are times where clinical and health leaders hear that, and somehow they have what I call AI envy, where somehow everyone else is ahead. The simple reality is, when it comes to AI and health, everyone's early in the journey. Microsoft is, most of our top clients are, and so it's important to recognize that that's where everyone is. But it's also important to recognize that as any market is young, the use cases and the things we're talking about now we'll probably chuckle at even in a couple of years. It is evolving. It's part of that process that we collectively will move forward.
Tom, in your book, you have a good like photograph or visual comparison where you talk about a photograph of a New York City street that had a bunch of horses on it, and I forget when it was, like 1908 or something like that, and then like 20 years.
Yeah.
1905, and it was, I think it was like, what is it, 20 years later, and then it had like a bunch of cars on it, and that's the way I think about it too. Is it like the, FOMO, like that fear of missing out? Like we all are just like, it's like, I don't know, it's in our DNA or something like that. Humans, we got FOMO, and I think that people are like, oh man, I'm behind the curve here, but we're just like, we're maybe like one little frame into that, like that 20-year frame series where now there are a couple of cars on the road, but it's still all horses everywhere, and so now we got to think, how are the cars and the horses going to exist, and how do we make it so that we have like the right, like literally rules of the road to get to the car stage? So I just love those pictures.
First of all, thank you for pointing that out. And I know I at least have one reader of my book, so that's great. But no, seriously, to your point, I mean, think about the history of Swedish, or I recently went off the board, but I was on the board at Virginia Mason, another great health system in the Pacific Northwest. But 20 years, or anyone listening, think about the history of your organization. 20 years is not a long time span. And yet the massive change that takes place, it doesn't happen where you come in tomorrow and it's done. It happens little by little. And that's where, whatever role you're in, the key is looking at what is it that you do. And chances are, if you're listening to this, you're a knowledge worker of some sort, clinical, operational, you're a rev cycle specialist, doesn't matter. What matters is looking at the work you do, the data involved, and how that's going to evolve over time. And that's where you don't have to be an expert at predictive analytics. You're already an expert at something that organization cares about, which will change. It may take 20 years to go from horses to cars or the medical version, but it is happening now.
No, that's so true, right? I mean, it's like the poll and everybody, like, it seems like we are all on the same page that it's an evolution. We have to get in, and it's a long journey. It's going to evolve. It's going to change. But the key thing which came out of the topic we just covered, Tom and Chris, is that there is an opportunity. People recognize it. People are jumping into it, and they're trying to kind of get that value unlocked. And that brings us to the key question: how do organizations, health systems, providers, right? How do they operationalize AI in their organizations? It's the classic, and Tom, you talked about, right, the different approaches that health systems will take, and there's a C-suite which will think about capabilities and capacities and so on, and there will be problems to be solved yesterday, right, with using AI or anything that really can solve the problem. So in reality, most providers are going to be doing everything, right? They are going to try to do something today while building for tomorrow. That's typically most organizations in some shape or form are in that boat. So from your perspective, when you talk about where health systems can find a way to accelerate their journey and get more out of AI ML today, how can they go from what we call experimentation to actually making AI as part of the production work flows and production use cases, where AI is at the core of that analytic strategy? What should they be doing? What should they be thinking in a foundational way?
Well, I'm chuckling a little bit by how you phrase that, where at least my personal view is, unless you're a research center or an academic medical center, the time for experimenting, I think, has gone. I mean, with Microsoft Research, we hire the 1,000 smartest people we can find in the world, give them staff, and let them basically play and experiment. And if you're part of a medical center provider organization that has the luxury of doing that, then I want to know, because I want to come work for you. But I mean, today, and I'm going to toss it to Chris in a second because I can talk about it, but he and others are on the sharp end of the stick for actually managing these big healthcare organizations. So, I often have the opportunity to meet with leadership, and they want to hear about, AI and all those things. And I always like to start the conversation to say, tell me the biggest challenges in your mission. You've been around 120 years, the practice of health and medicine has changed, but your mission is not. Tell me about that. Tell me about the things as a clinician, when you're going home at night, you're thinking, if only I could do that better. Those are the starting points when it comes to taking AI and driving value at scale. And so when people kind of typecast it, say, well, it's technology, I'm going to toss it over the wall to my technologist or my data science officers, those are all important people, important players, but it starts with a systemic approach to understanding and then making the kind of investments that go beyond that one or two use cases that really, if all you do is one or two use cases, and even if they produce value, I guess that's an experiment. What people care about is being able to drive that value at scale in a way that's very measurable, whether it's your clinical outcomes or your financial returns. And I can talk more about the components of that, but to me, it gets back to that fundamental leadership imperative. Any organization that's really moving with agility and at scale, it starts with that leadership perspective. So Chris, I don't know your thoughts, but again, you're on the sharp end of the stick.
Yeah, no, I totally agree with that. And like you, like if there are thousands of people working to do experiments, I want to join them too. I think you're exactly right. Like the way I think about it is, you want to go with wind in your sails. And so if the organization is trying to accomplish something, and organizations are usually semi good about like transparently stating their KPIs or their goals. Like I think most of us probably have some sort of balanced scorecard and some sort of like reasonably widely known measures of success. And so it might be like a length of stay goal. For example, yeah, we have a goal to decrease length of stay by 5% across Swedish. And so if I were coming into the conversation and it doesn't matter if I'm a kind of a data scientist or if I'm trying to manage an analytics department or if I'm helping to run IS, I would try and understand what my organizational goals are, and then I'd probably have a little bit of curiosity. I learned a lesson from a lady I worked with, like I don't know, probably 10 or 15 years ago, that like Google's a big friend here, and I would say, hey, like I wonder who has like worked on improving length of stay, kind of using AI or just using different approaches to it, and then wonder if my part of the organization, how it could contribute to the bigger organizational goals. Because the thing that happens particularly in many of our bigger organizations is, in Swedish as part of the Providence system, which is, a big system on the West Coast here in the US, 51 hospitals, is that invariably there are different people all working on really important stuff, but they're kind of competing for similar sets of attention and resources. And so sometimes it's the things that are more mission aligned or more aligned to the goals of the organization that ultimately get the attention and the resources. And so that's kind of a little bit of the calculus that I try to do, is try and keep things aligned. And so as I'm analyzing particular use cases for AI, I probably would really think twice about swinging at the pitch that's a little bit off axis from the things that are the organizational priorities. And I would be inquisitive or curious about ways that emerging technologies, kind of that transition from horses to cars, could help in the things that are important to the organization. Because I feel like all of us are stewards of our organizational mission. And part of the way that I can serve the organization is to have a broad scan, kind of like we're doing now in this webinar of, hey, how is our industry changing and what can I harvest and bring back to the organization that allows me to contribute value and help the organization get to the goals that it said it wants to do. And so I think that kind of sailing with the wind at your back is kind of the mental picture I have for myself in terms of trying to work on this thing versus not that thing.
Well, what I love about that, I know we've got to move on, is some of the things you said. One of the best things that I look for is when an organization says they're serious, they're making some investments, sometimes significant investments in AI and digital transformation, is simply to say, can I connect the dots between that investment and everything found in your strategic plan? Because if I can, then that's a great starting point that binds everyone together. The second thing you said, and it's interesting for those listening to see how it goes in your organization, but I'm an advisor to a very large national health system, and I had the opportunity to do some work with them, and it was kind of the post-COVID conversation where they got one group looking at how to go deeper and be better at telemedicine. They've got another that's doing several pilots around the country with hospital at home. They've got others looking at hospice and normal home health to make that more intelligent. What's interesting to me is, one, all of those were kind of separate silos or vertical slices of people working on it. So, to me, that care anywhere is a huge opportunity. And then once you bring that together, you start mapping the process to say, where do I bring intelligence in behind any of those things when it comes to being able to start driving not only alignment in your strategy, but execution in a way that you're really leveraging technology and data across multiple initiatives that really should be the same anyway, in my view.
That's a good point. And Tom, I want to take that last point which you made about data and your strategy, right? How does it all flow together and fit together? And one thing that we see a lot at KenSci is when we are working with an organization, a health system, to help them get their AI solution in place, and really we are building all the solutions we talked about around operational and clinical and care management workflows, all of that. As we do that, we find that organizations have been typically struggling with getting their data ready for and advanced analytics, and that includes AI, but also includes foundational analytics, which are which works in a way, but is not keeping up with where the value of data sits. And Chris, I want to come to you on that, right? So you care a lot about data and where it intersects with the use of data, which is in analytics and in workflows and use cases. What is your perspective on the timeliness of data? Talk to us about how data, when it is available and how quickly can it be acted upon. Has that changed in the last 12 to 18 months in terms of the outlook on that? And also, if you can talk, when we talk about data, can you give us a little bit of flavor of what happens to the non-EMR data? Is that coming into the flow, and is there a need to bring the non-traditional data sets into the analytics frame, and then look at what can we do with the data, and then all the advanced AI and ML technologies can be brought to bear on that data? But what is that data today looking like in terms of timeliness, quality, and kind of data that is needed?
Yeah, I think that's a really good question and a really good area for people to be very thoughtful about. And it's one of the things that can separate kind of data science from data science fiction, because you can think about a lot of things like, oh, and actually Tom was mentioning one before, like, and I'm a home critical care doc, so I work clinically in the ICU. So like, wouldn't it be lovely if we had like a universal prediction algorithm that could predict either like in-hospital mortality or propensity to need the ICU? And that would be a really cool thing. And like cognitively or theoretically in our minds, it's not very difficult to construct like how we would go about getting to that algorithm. But it doesn't really work basically at all if you're gonna just ETL your data to the EDW and then run the model once a night at like 2 a.m. right? Because it's going to have a latency that's like 24 hours, and you're not going to be able to predict stuff that's like, as I'm admitting the patient to the ICU like 18 hours before that or whatever, they're sitting in the ED, like it's not helpful, right? And people like we know that if we take a step back and we think about it. But I think that we need to really kind of take a look at the timeliness of the data, particularly on the acute side, where like things are compressed and like minutes matter, seconds matter, where we need to make sure that we actually have a sufficient data set to kind of predict and act on in order to get to the outcomes that we want. And then, so timeliness is one super important point of it. If you're operating maybe like a payer, or you're working on the ambulatory side where maybe your time is maybe more in kind of days or months, then maybe that minute by minute thing is a little bit less important. But that also brings up kind of the amount and the density of data. And I think that's one of the things that like our industry hasn't, I don't think, talked enough about, which is like basically EMR data suck. And they suck for reasons of kind of like sparsity and non-resemblance to truth. That the way that things are in there, if you look at just like think about all the variables, like we use Epic, and but think about Epic or Cerner or whatever, and think about the different variables that are in there and how they got to be in there. And I always think about like the mental model I use is that of like a platonic ideal. I think about like, hey, there's a patient, and if I could measure every facet of them and like take pictures of them and movies of their cells and like, do functional MRIs, like we could know everything about the patient. And then think about like what's actually in the EMR. And the EMR is just subject to like the, garbagey notes that I write as a clinician, saying, hey, the patient complains of this thing, and this is what the family told me. And by the way, I'm entering that at the end of my shift, because it is what Tom was saying about people doing 2 hours of work after their day's over or whatever, because, I'm going in. And then if I'm like thinking about it from a data perspective, then what I have to work with is like latent data that bears like a very striking resemblance of like, or passing resemblance of like my view of what this person is. And so like we don't have the data density or like sufficient kind of timeliness of data to get to what we need in order to make some of the predictions that we'd want to make. And so imagine if like you could have like real-time functional MRI data come in as raw data. Imagine if you had video data coming in as raw data. Imagine if you had wearable data coming in as raw data or whatever. Like we need to think, and this is not, like we're probably beating to death, but the horses to cars journey is, like we're in the beginnings of that, and we need to have, I think, flexible mental models that account for different data structures and different data sources that have different time constants too, and different data densities. So anyway, it's a super interesting point, and I think we're just beginning our journey as an industry.
Lovely, lovely. That's see, I think I mean we'll get into the poll right now, but this is important, right? I mean that it is part of where the challenges are, is to understand the shape of data that you need to be able to operationalize AI ML. So the question here is biggest challenge to the acceleration of AI ML in your organization, and obviously the options are pretty much very broad, but really I want to understand where people are, and I can see the responses come in. It seems to be getting where we were talking about, which is what happens with data. And then obviously we'll get to the budget part. I think that's a good segue for it. But it's amazing to see that there are a lot who are already ready for advanced analytics. They have that thought through of that process, and are ready for unlocking the value for advanced analytics that advanced analytics and real-time insights bring. And that's a key point we made. So
hey, I can just go ahead. Sorry.
Go ahead.
I was just going to say, as people are voting this, just to pile on again to Chris. And Chris, I assume suck is a technical term, but we'll leave it there. So thinking about Chris's comments, a newly minted doctor in 1950 would go their entire career, 50 years before data doubled. Today, data in healthcare is doubling every 73 days. So think about that. I often get to work with leaders, and they've been to a conference or they've read an article, and I hear them saying, data is the new currency in healthcare. Whenever I hear that, the question I like to pose is, if data is the new currency, are you managing it the same way you manage your finances? And the answer is always no. So that modern data estate, to me, is the #1 critical to success factor, that when organizations invest in it, things go faster and they get better. When they don't, that's the place where it creates long time to value. It greatly increases the risk of anything you're doing failing. But again, all those points Chris made about the knowledge, the data, and that's before we even started having the broader conversation of, well, okay, let's start bringing in things like social determinants of health, and a lot of data readily available that have high correlational value to managing the health of populations.
No, absolutely. And I think, look, I think the whole idea of getting organizations to really thread the AI conversation in a broad way, right? I mean, coming to our last piece of our conversation, that it is not just, as you said, about identifying where you can use AI. It's about what you need to do around it, and organizationally what you need to have it from a DNA perspective to really get that going, and data is a big part of it. But also an important facet of it is actioning on what the data is telling you, and that's what I call the critical piece of operationalizing AI. And so let's talk about what that means, right? So because ROI, and we had few people talk about budget, right? So ROI is an important aspect of how all of these technologies are operationalized. So Chris, let's get your perspective on this. And this is a short segment. We probably are going to spend just 5 minutes on this, but this is a very important segment as well. How do we drive adoption and comfort for usage of AI and advanced analytics in an organization? And that's a big question, right? I mean, it's all about trust. How do we create that trust in AI? So, Chris, what do you believe are the factors that are impacting and can be activated to really drive trust in AI and other such technology-led changes and innovation?
Yeah, and I think, and maybe we could lump them into kind of two buckets. Like one are just organizational change factors, and the other AI specific things. But in the organizational change, like what I don't know, come to think over time is that there's a bell-shaped curve of adoption or adoptability or propensity to adopt new technologies, and it's there'll always be a group in the laggards camp, and there'll always be people kind of naysayers saying things can't work. It's those kind of like early bleeding edge to middle sort of adopters that are the key constituency to kind of think about. And one of the things that I think is just wonderful about our industry is that people are in it 9.5 times out of 10 because they really want to improve the health of folks. And so it's not very difficult oftentimes to find groups of willing clinicians or folks to engage in activities to improve. And then there's a very virtuous feedback cycle where if a certain thing, and it can be AI or something different, has an effect, and you can measure the effect, and you say, hey, this thing seems to be, causing this other thing over here. Like, isn't that cool? And then, you can leverage that with that FOMO that we were talking about before, is that other people then want to join the cool kids and do the things that are better for patients. And so I think there's a way to step through organizational change that is kind of like proven across different questions that actually is probably the most important thing with respect to AI. And then within AI, there's a lot of kind of concern about like kind of the second thing down there about kind of bias and fairness, and then the kind of explainability or the transparency of models and how different models arrive at their conclusion. And I think to be fair, like I think we're still learning our way into this as an industry where I think about this in terms of Tesla sometimes is like the question isn't whether or not Tesla cars ever crash. It's a little bit like, do Tesla cars crash at a rate that's less than human piloted cars? And that's like going to be a really, really tricky thing for AI in healthcare, because like we have this notion of infallibility when it comes to machine-based processes. But if we're looking at algorithms that have predictions with certain operating characteristics, we'll have to think through very carefully how we go about implementing them, so that it's that kind of, actually Tom was alluding to it earlier, but it's that synergy of person and machine, so that together we can be better and make sure that we're creating environments that actually end up overall significantly helping patients. And I think it's incredibly possible, and I think a lot of great people are working on the ways to do it safely. But I think that some of the things you've highlighted there in terms of transparency of the factors in a model that lead to this prediction, I think is a good place to start, and gets actually to the equity and bias piece of it too.
No, that's something that I think it's cornerstone to what we bring at KenSci, and we put a lot of value on the explainability and interpretability. So that's a great call out. Moving into the last piece of this conversation, and Tom, I'll come to you. We are hearing more and more about the biases, the fairness question, right? Which is how do we eliminate or address biases which are both algorithmic but also data itself that we are using, and that's been an inherent product of the systemic bias that has existed. It is reflected in our data sets and in our outcomes, right? So we are using that to train it. So there's a lot of work which has gone on. So can you talk quickly, very, very quickly, about what this question of health equity is, and what are the issues, and what is the industry really doing to address that?
Yeah, well, quickly, I want to do a call out to KenSci for the great work in creating visibility, shining a spotlight on these issues. I know you've done great work on that. So the fundamental question is this: AI will produce good for all or for some in healthcare, and we collectively will get to decide that based on some of the decisions. So quickly, bias. There was a great and kind of scary article in the New England Journal of Medicine last June, highly recommend it, where they showed in at least 10 cases on things like clinical decision support. Each of these things were producing overall good, but producing it with great variance based on your race, based on your gender. So the question is, even if we produce something that's good overall, but we're not bringing everyone along, is that okay? It's legal, it's regulatorily compliant, but the question comes down to ethics and where you stand on things like that. So those things are happening not because Dr. Evil is somewhere behind it, but because of things like data, or the unconscious bias of those developing those algorithms. Beyond bias in algorithms, we see things like, with the rise of telemedicine in the last year, there's increasing data that shows it's producing overall good, but typically that overall good are for people middle class and above. So as we move forward to things like virtual care, we have to be mindful of the fact that not everyone has broadband, not everyone has smart applications. There are many people that we do things that we don't think about, but their digital literacy skills are so low that even if they have access to broadband and a computer, they probably aren't going to take advantage of it. So these are all the things infinitely solvable that we have to be mindful of as we move it ahead.
No, thank you. This is super important, and I'll actually leave with a question for the audience. This is a recent study I was looking at, and it found that the algorithm underestimated Black patients in need of extra care by a certain percentage. And the question to the audience is, can you tell us what that percentage was? It's just a kind of, do you know your health equity kind of study landscape or not? It's a fun question there. But as we dive into that and we see how people are voting, they're coming fairly close. It's amazing. So Tom and Chris, I think, thank you very much. This was a very engrossing, and obviously we are scratching the surface in terms of the conversation that needs to happen. And 60 minutes is obviously too less for us to cover that, actually. And as we get into the Q&A session, which will be right now kind of getting into, one of the things that I want to bring as a question. We have actually a couple of questions coming in from the audience as well. So we'll start there. But before we get into that, the question that really everybody is getting into, so is how do we really? It's all about operationalizing, right? I mean, the benefit is not in question. The question is, how do we get and how do we really eat this cookie, right? And so the question from Gayatri Apadu Townsend, this question is, do we need to implement informatics or data analytics studies to clinician or physician, as some of them do not understand the how and why of technology? And Tom, you have to drop, so let's start with you. What do you think is there a gap in terms of informatics and data analytics as it's understood across the spectrum of healthcare?
Yeah, great question, and way too much to talk about for the time we have. So first of all, great question, great call out. You know, the last time I checked, if you're in a provider organization, you have a mission providing health and medical services. Microsoft's a technology company, so I always look for the commitment of big organizations where the first place they start when it comes to AI across an enterprise is how they are bringing their clinicians along, doctors, nurses. And if they're doing that, that's another predictor of a great win. I was doing a workshop pre-COVID with the largest academic pediatric center in Canada. And as I was getting ready to get started, all the doctors were gathered at their normal table, and you know, the medical directors were razzing the head of radiology saying, you know, this is about AI. Have you gotten your Uber certification yet? Because you'll probably need it. Where they make this assumption that somehow it's going to have an adverse impact on a clinician. Anyone who understands AI properly applied to augment all of the things computers will never do, you know, doctors and nurses and others should be leaning in, because properly applied, it gets rid of a lot of the repetitive work that Chris was alluding to. It makes physicians feel more like why they went into medicine rather than the way we've turned them into data entry clerks. So I just say huge opportunity, but any enterprise AI program should start by having those computer or the clinicians right there with their hands fully on the steering wheel.
Great answer, great answer. Thank you. Tom, I know you need to go, so thank you really for joining this conversation and for.
Well, first of all, thank you, and Chris, good to see you, and it's just really appreciate the great work that KenSci has done. I've had the opportunity to work with you through the years, and I know you're doing great work and having impact, but thank you so much for having me. Appreciate it.
No, thank you. And thank you, Chris, as well. I think this was a great conversation. Hopefully, we sparked a lot of questions in our audiences. We also hopefully gave people a framework in which to think and the things to consider and focus on. Again, this will be available for people in entirety as a recorded webinar. So if you have missed pieces of it or want to dive something into the conversation that Tom and Chris, you both discussed, this will be available for folks. But I do want to encourage people to reach out if you have questions. We are here. We have done tremendous amount of work with a lot of large and medium scales hospitals and health systems and payers and other healthcare organizations. There is a ton to uncover here. There's a ton to accomplish here. And we are excited. Hopefully you are excited as well. And again, thank you to both Tom and Dr. Chris Dale for joining us, and for all of you as an audience to come in and have this conversation with us on a Friday morning. So thank you very much. And thank you, Christina, for helping us through the webinar setup and execution of it. Thank you very much to everybody.
Thanks very much. Take care, folks.